Hello, I am honored to speak with you today about a topic very close to my heart and my health, creatine in women's health. I'd like to thank all the sponsors of the symposium and Dr. Diego for inviting me to speak with you today. I'm actually here to make a call for more research and for those of you in practice to think about how creatine may help either yourself or the women and girls that you may consult with. So I have two slides to begin with, and I'm not going to really take much time. I think most of you understand that there is this two-step process for creatine synthesis, starting with two amino acids, arginine and glycine. And that the sort of core of what we're talking about today is the creatine kinase circuit, this high energy pathway that supports the energy needs of basically every cell in our body. It is the core of the reason that we're talking about women's health. So to start with, as we look at the beginning of life, we think about the pregnancy and the health of the newborn baby. The review of the literature sees creatine increasingly appearing in studies of both male and female reproduction. The oocyte, or the egg, requires large amounts of energy for development in preparation for fertilization. And creatine metabolism occurs within both the human as well as the mouse model. Of course, hard to do research all the time on human tissue, and so we do depend on the animal model. The source of creatine in the oocyte remains somewhat unclear. Is it endogenous synthesis or is it cellular uptake? But there is considerable research on the importance of creatine metabolism, not just in the oocyte, but also in the surrounding cells. These somatic cell lines give a lot of support to the nutrition and development of that embryo. Additionally, there is considerable research on the importance of creatine metabolism in optimal sperm motility, so that the ability for the sperm to travel and be mobile is dependent on this creatine kinase circuit. And so both male and female reproductive health is affected. There's further analysis required to understand what is happening with the follicular fluid, the oviductal fluid. We don't really have a lot of data in that area, but we do understand that creatine metabolism is active in and plays a role in the bioenergetics of fertilization. The endometrium is the mucous membrane lining the uterus, and it thickens during the menstrual cycle in preparation for possible implantation of the embryo. There is evidence that the creatine kinase circuit is active in uterine tissue, and that the components of this metabolic system change throughout the reproductive female cycle. So wherever we are studying creatine and the creatine kinase circuit, it changes as from the moment of for preparation for fertilization, at fertilization, and then throughout the months of pregnancy. And so one point in time does not tell us about what is happening during the entire 9-month period of pregnancy. The myometrium is the muscular wall of the uterus that undergoes significant changes in size and cellular properties during both pregnancy and pathological conditions. In particular, in early pregnancy, pre-pregnancy and early pregnancy, the creatine kinase circuit is somewhat inactive, not very active, low levels of phosphocreatine in the tissues. But as pregnancy progresses, all of this increases, and it kind of makes sense. The myometrium is required for optimal contractile performance during labor and delivery. And so the activity of creatine kinase circuit during labor and delivery would be of utmost importance. So all of these tissues, the available literature supports creatine metabolism being considered an essential component of bioenergetics for successful reproduction. So for the human placenta, all the way to the fetal tissues, all the way through to the birth of the neonate. And further research is really needed for the understanding of the role of creatine at all of these time points. Data from both human and animal studies have established that pregnancy modifies maternal creatine homeostasis. Maternal characteristics associated with circulating creatine concentrations during gestation, alternations during gestation, and as I said, at the point of birth, every single point in time, creatine interactions change. The creatine kinase circuit is thought to play an essential role in energy homeostasis during embryonic development, particularly of the central nervous system. And so brain development is critically dependent on creatine nurture of the mother. So we should be examining the dietary intake and the creatine intake of the mother, her creatine levels, because she is supporting not only her own tissues, but the tissues of this growing fetus, the central nervous system development of the brain, and then preparing that neonate upon delivery, because upon delivery, that new baby is now responsible for its own creatine synthesis, and levels of creatine usage continue to rise in the few months postpartum for the baby, and continuing central nervous system and brain development. And we know that in the case where a neonate cannot synthesize creatine, they have creatine deficiency syndrome, they will have poor brain and central nervous system development and require creatine supplementation. And with supplementation, all those symptoms abate. So clearly the role of creatine is very, very important. Okay, going on, we've birthed the baby. Now we move into the adult female and women's health. Here I'd like to call out Dr. Abby Smith-Ryan for really doing amazing work in this area at the University of North Carolina in Chapel Hill. I also want to thank Dr. Rick Kreider from the Texas A&M Exercise and Sport Nutrition Laboratory. You'll see that I kind of have doubly noted his logo here because he shared some of his slides with me so that we could give you consistent information across our Creatine for Health board. So the ergogenic potential of creatine can be attributed to several mechanisms and may have different effects in males and females. Females typically have 70 to 80% lower endogenously produced creatine stores compared to males, and so may have actually an increased benefit from creatine supplementation. Now, it's very important to understand that creatine levels in females and utilization of the creatine kinase circuit changes throughout the life cycle due to hormone-related changes. And because creatine kinase and phosphocreatine may be linked to endogenous estrogen levels, you can see here on the graph on the right, sort of the monthly cycle and how creatine rises and falls along with the level of estrogen and progesterone. So this is very important to know what moment in time are you testing, both across the life cycle of the female, pregnancy, postpartum, during post-menopause, perimenopause, etc., and also during the monthly cycle. Where are you testing? And so following the protocols that have been established by Dr. Abby Smith-Ryan, by Dr. Stacy Sims, and others, looking at how to study females during their premenopausal years is very important to follow those appropriate methodologies. Also, I wanted to call out Dr. Stacy Ellerly as well for her research, her really groundbreaking research in the area of pregnancy in neonates. So premenopausal females appear to be effective or have efficacious outcomes from creatine monohydrate supplementation, improving strength and exercise performance. Now, what's important to note is that many women and many of my female athletes that I work with are concerned about taking creatine because of body weight gain. And in fact, in the research on females, we don't see the same kind of weight gain that we see in male subjects. So it may be less of an issue in females than in males. And certainly the potential for adverse effects are no greater in females than in males. Basically, there are, no negative side effects that we know of or have ever been seen in the very, very thousands, large population of subjects who we have used in studying creatine. Studies that have shown benefits. We've seen adaptations to plyometric training that can be enhanced with creatine supplementation. That was a 2016 study. And then many other studies, running, jumping, strength, power, all of these have been shown to be enhanced in females supplemented with creatine. Now, as a result of hormone-driven changes that I mentioned throughout various stages of female reproduction, study design is critically important. And endogenous creatine synthesis, creatine transport, creatine kinase kinetics, and creatine bioavailability can be altered over time. So the potential for positive implications for dietary creatine supplementation for females needs to be studied using appropriate methodology. Additionally, no research has investigated the relationship between hormonal contraceptive patterns and creatine kinase. So this is really important to understand. Serum creatine kinase levels are significantly elevated during menstruation compared to non-menstruating years. And so we need to be also studying creatine and advancing age. And that is what will come up next. Postmenopausal females may experience benefits in skeletal muscle size and function and favorable effects on bone when combined, with resistance training. And so the idea of supplementing women as they age, hoping to hang on to both muscle as well as bone, creatine supplementation may play a very important role. There has been a meta-analysis looking at older females. There were 8 studies included in this meta-analysis, ultimately as it was pared down. And what was found were significant gains in muscle strength, especially when resistance training lasts for at least 24 weeks. Now, that's really important because if studies are not long enough, then you don't see the results. And that seems to be one of the problems of the studies that we're experiencing, that outcomes are insignificant because training doesn't last long enough. Creatine supplementation has been shown to act as a possible countermeasure to the menopausal related decrease, not only in muscle, but also in bone and strength, because of its association with reducing inflammation, oxidative stress, and serum markers of bone resorption. Now, there is conflicting data on this as well. This study, this quote, this third bullet point, is from the position stand from the International Society of Sport Nutrition, just published on nutrition for female athletes. So it is very important to look at the body of evidence and really to get more data. We really need more data. I can say from my own personal experience, and typically it isn't what the presenter will tell you, but I have been taking creatine for 30 plus years, and I am a strong advocate for its impact on my maintenance of muscle and bone health. I do lift, I power lift 3 times a week, and I recommend that for everyone. Also important, of course, is getting in enough calories, enough protein, enough bone building minerals, and other nutrients. And so it is a holistic approach, but creatine is likely one part of that. Well, what about the brain? Creatine supplementation may be even more effective for females by supporting the pro-energetic environment in the brain. As we said, females have 70 to 80% less endogenous creatine than males. And so when it comes to brain health, critically important. A dietary epidemiological study in 2020 examined the association between dietary creatine and depression in US adults. They surveyed from the years 2005 to 2012 using the National Health and Nutrition Examination Survey data. And they looked at 22,692 participants older than 20 years of age. And what they found was a negative association with depression that was strongest in females. So again, epidemiological studies, more research is needed, but this is a very interesting place to begin. Preclinical and clinical evidence indicates positive effects from creatine supplementation on mood and cognition, possibly by restoring brain energy levels and homeostasis. Even more important, cognitive studies amongst older women supplementing with creatine are few. The findings are, as we say, discordant, meaning that some say yes, some say no, some don't give any data at all. And so it's very important to start to examine this relative to females throughout the life cycle. Again, I'd like to end with a call for more research and a quote from Dr. Abby Smith-Ryan. The current body of literature that has evaluated the effect of creatine supplementation in females suggests that the risk to benefit ratio is low, with most studies indicating that there are numerous metabolic, hormonal, and neurological benefits. The lack of discussion and exploration of creatine use among females across the lifespan is a disadvantage and missed opportunity, since a better understanding of creatine metabolism pre and post menopause yields important implications for improving health and exercise performance for females across their lifetime. You know, it is very difficult when the only tools that you have for counseling women are either talk therapy, pharmaceuticals with high levels of negative outcomes, negative side effects, and not great impacts on benefits, or a scalpel. If we could have a nutritional supplement that had no downside, no risk, with a pretty good bet for benefits, what a great intervention that would be. So thank you so much. It has been my honor and pleasure to be here with you today. If you have any questions, please do not hesitate to reach out. Here are all the ways you can reach me, along with listening to my podcast. So again, thank you so much, and I hope you enjoy the rest of the symposium.